eTwo combines the unique Sublime and Sublative applications for comprehensive facial rejuvenation. Sublime Skin Treatment uses the ELO's combination of safe and effective levels of infrared light and bipolar radio frequency energies to remodel the deep dermal layer of the skin by stimulating new collagen growth. The treatment can be performed on all skin types, but is most commonly performed on the face for jowl laxity, neck laxity, sagging under the eyes, sagging brow line, and nasolabial folds. Treatment procedure. Remove all jewelry from the area. Mark vector zones on the face with a white eye pencil as shown here. Performing repeated passes on each zone leads to bulk heating of the dermal layer, leading to collagen remodeling. Apply gel and use protective eyewear for both the operator and patient. Set the treatment parameters according to the treatment area. On thick skin, use the maximum RF energy of 100 joules per cubic centimeter. Place the applicator firmly on the skin surface in a perpendicular orientation, ensuring complete contact. Press the trigger and wait for the beep. Then, slightly lifting the applicator, move it to the adjacent spot, overlapping 50%, and continue until you've treated the entire zone. Move in a ladder-like manner. For faster treatment, use the auto mode. Move the applicator with the RF electrodes parallel to the direction of desired skin tightening as shown here. Treat the first zone with repeat passes until heat is felt. Mild edema and erythema are acceptable. Move to the next zone and treat in the same manner. The tip cooling can be set as needed. On thick skin areas, use normal mode. For thin skin or bony areas, or if the patient is sensitive, switch cooling to strong. Usually, there is an immediate effect of skin tightening that can be observed after treating one side of the face, using the other side as a reference. Compare the treated and non-treated areas while the patient is seated and after removing the gel. Treatment protocol. The number of treatments varies with each individual patient. Most patients achieve their desired results after 3 to 5 sessions. Treatment intervals are 3 to 4 weeks. For maintenance, one treatment session may be performed every 6 months, or as needed. Sublative treatment for skin rejuvenation by Syneron. The sublative treatment uses fractionated bipolar radio frequency technology, placing the heat energy effectively into the upper dermis, where it can produce a significant increase in both collagen and elastin production, with minimal epidermal disruption. Treatment procedure. Before beginning treatment, have the patient remove all jewelry. If using a topical anesthetic, remove it completely. Wash the skin with a non-greasy cleanser and dry thoroughly. Set the program and RF level as shown here, taking into consideration the severity of the skin's condition and bone proximity. Connect a tip to the applicator. Make sure that the embossed T on the tip is aligned with the upper part of the applicator as shown here. Place the applicator on the skin surface in a perpendicular orientation with complete contact and slight pressure. The green light bar on the back of the applicator indicates that the applicator is sufficiently charged and ready to pulse. Trigger the pulse and then move to the adjacent spot with 50% overlapping. Repeat until you've treated the entire area. The tip must be in full contact with the skin on every pulse. If treating areas with wrinkles or depressed scars, stretch the skin to achieve a flatter surface for full contact with all the electrode pins. For treatment under the eyes, place the applicator near the lower eyelid, roll down, and push the skin up for full contact. When treating over bony or contoured areas, such as the forehead, roll the tip and push the skin for better tip contact as shown. Every couple of pulses, clean the tip with a gauze pad moistened with alcohol and then dry. When using high energy levels, frequent tip cleaning is necessary. Complete a full pass on the entire treatment area. Perform multiple passes on areas with deeper lesions, such as acne scars, wrinkles, etc. Immediately after the treatment, the patient's skin will show erythema and some edema, and the patient may feel a heat sensation for a few hours. If necessary, you may cool the treated area and apply an emollient cream to soothe the treated area. Pinpoint scabs will usually appear on the skin 24 hours after treatment. These will shed off naturally after a few days.